areas of nursing are you interested in and why?
I like med-surg. I like the variety of patients that you get to see and all of the different skills that you get to use.
Tell me about your clinical experiences. Which rotations did you enjoy the most and why?
I enjoyed all my clinical experiences. I think that I enjoyed the emergency room the most because of the variety and all the skills that I got to practice and see performed.
What was the biggest mistake you ever made and how was the problem solved?
I had an emergency situation at where I was working, and we had two patients with similar names. In the midst of the emergency, I glanced at the chart wrong, and I ended up calling the wrong physician about the right patient, but the wrong physician. He ended up giving me orders. Apparently, he didn't realize it wasn't his patient. And as soon as I hung up the phone, I realized my mistake. I called the correct doctor. I had to call the wrong doctor back and explain what had happened. Everybody was okay with it, thank goodness, but it was pretty embarrassing.
Tell me about yourself. What are your strengths and why?
I'm very positive. I love to learn. I love to try new things. I'm always, when we get a new patient in with a skill that I haven't practiced in a while or wasn't aware of, I'm always up in the room, even if it's not my floor, to try to learn a new skill.
How about your weaknesses and why?
I'm a procrastinator. I know I'm a procrastinator. I really have to fight myself not to put things off till the last minute. I think nursing has really taught me to overcome that because the first time you put off your charting and have an emergency and you end up being late from work hours and hours because you had put everything off, it fixes your procrastination, but I would say that's definitely a weakness.
How would your most recent nursing instructor describe your performance in the clinical setting?
We didn't actually have our teacher with us. We had preceptors the entire time with the way our program was run. I think that all my preceptors would say that I was very respectful and pleasant, very friendly, and have a very good bedside manner with my patients.
Tell me about your most trying clinical assignment and what you learned from it.
I think the most trying clinical experience I ever had was I saw another nurse. It was not my preceptor, but working in the same unit, being very disrespectful and unprofessional around a patient that she was caring for. And it really taught me the importance of remembering where you are and how to be professional. It still sticks with me. I didn't feel I was in the place to correct her, but it bothers me that I didn't say something because it was very disrespectful.
What skills do you feel you have gained from your past work experience that may help you in this position?
I've been an LPN for almost 12 years, working in a long-term care facility. And where I work, with the skills that we do, the LPNs and RNs are equal. They do everything the same. So it's really helped my confidence in knowing that I'm capable of doing the same things that the RNs do. I think it's going to help with my transition.
What are your future career plans? What do you expect? Where do you expect to be in 2 years? What about in 5 years?
I would like to work in a hospital, starting in whatever department I can get a job. I would like to move to med-surg. I really like the variety of skills and feel that it would keep you sharp in everything that you learned. And eventually I would love to be in an emergency room. I really enjoyed that rotation. It was my favorite. Every day was different and I really enjoyed that.
about yourself? How would others describe you?
I'm happy, I'm friendly, I get along well with others, I'm very caring with my patients. Even though I'm a procrastinator, I am a perfectionist. I do not like to leave things half done. I want to make sure I do my job and I do it right.
We do not have any positions open at present in the areas that you indicated interest. Would you be willing to accept a position in another area?
Yes, I definitely would. I love to try new things, and just because the emergency room and med surg was what I was preferring, I really enjoyed all my clinical rotations, and I would love to learn more in every department. So yes, I would definitely be willing.
Tell me about a time when you had to establish priorities during one of your clinical experiences.
The clinical preceptor nurse that I was with had sent me out of the room to get something that the patient had requested. And as I left the room, another nurse who knew I was there as a student had asked me to grab her something. She was working with a different patient. And I got a couple steps down the hall, and another nurse had hollered out of the room that she needed my assistance. So I had to prioritize. I had 3 nurses needing stuff at the same time, so I just took my time and I decided which one was the most important. I didn't feel grabbing a pillow for the patient, even though comfort is important, wasn't as important as the nurse that had hollered out of the room that she needed my assistance immediately. So I just took my time. I did all 3 items that the nurses were asking. I just had to prioritize which one needed to come first.
Tell me about a time when you went out of your way to assist a family or patient, even though you really did not have the time.
I would have to say that was probably at my current job, just because I really didn't have to, with the preceptor kind of stepped in and took charge. But at the job I'm working at now, we were caring for a patient who was deteriorating. She wasn't eating well, wasn't drinking, and I was in the middle of my very busy 8 a.m. med pass. I'm sure you know how busy those are, especially in long-term care. And while I was standing there after I gave her medicines, I gave her a bite and she ate it. And I gave her another bite and she ate it. So I didn't care how busy I was or how many meds I had left to do or how little time I had. I sat down and I fed that patient and gave her fluids until she was done. I stayed with her because I was just happy that she was taking something.
Thank you for your time, and we will get back to you as soon as we've made our decision. Thank you again.
Thank you very much for your time.